First, we're going to start with just a quick review of what's going on with COVID-19. Obviously, keeping up with the news is a full-time job these days with all the vaccine information coming out, change in quarantine restrictions, big surges all over. So I'll just briefly touch base on some of the headlines the last couple weeks. Then we'll go through how to approach making decisions and balancing the risks and benefits. And we'll talk about some of the other things mentioned before, children's development and learning and coping during this pandemic. So first off, that we have some bad news in terms of where we are today. This graph is perhaps unfair because what it doesn't emphasize is that we're doing a lot more testing now. Back in April in New York City, if you were sick with coronavirus, you didn't have access to a test unless you ended up in the hospital. So, so we certainly had a larger surge than is reflected in that chart. However, the numbers now are probably about the same as they were in April because we're starting to see the deaths be about the same nationally as what we saw back then. And it's really a shame and really hard to see. And I know it's unsettling for those who may not have had it in their communities yet to see it come closer and closer. But with these numbers, and it's really just all over right now. And we've also started to learn more about the secondary impacts. There have been new studies coming out about rates of obesity, skyrocketing, that like on average, children have gained about 7% more weight than expected and about 25% more likely to be obese than last year, which is a big number. Mental health impacts, we've seen, jumps in depression, anxiety, eating disorders, suicidality, all of these things. And obviously the financial impacts are significant. These lockdowns have been hard on many families. But there's also some good news, aside from the vaccines, which everybody's heard about, there are new therapeutics coming out. Some of the synthetic antibodies are very promising and will hopefully decrease the likelihood of death for some of the sickest patients with coronavirus. We've also got some new data that came out. They went back and looked at thousands of samples from blood donors to really try to get a sense of how many people had antibodies and exposure to coronavirus between Thanksgiving of last year and when we started tracking the virus. And with that information, we estimate that at least 8 times as many people as we've identified in the United States have had coronavirus. And with that number, we can assess that the mortality rate is lower than we thought at first. The original estimates were closer to 2%. And so the most accurate estimate does seem to be like 0.25%. But then, what do you make of that number? It's very difficult to compare it with anything because we've never done such digging. If you look at the flu, for instance, we've never done huge studies to look at how many people have the flu and don't end up in the hospital annually because those studies are expensive. And so this number, if you look at the data, is lower than what you'll see for the flu. But that's mostly because we haven't looked at the denominator as closely. So it's kind of like comparing apples and oranges, but it's lower than we might have thought. The vaccines are coming out, and I'm going to talk more about that on the next slide. The mitigation efforts we've put together in schools have been working, and a lot of places have recognized that it's possible to keep especially elementary school and special education schools open, even if there is community transmission, with multiple layers of preventive measures in place. And so that leaves us, to think about how we can cope, because this is a long way from being over. So to talk more about the vaccine, there's obviously, 2 big vaccines coming out, the Pfizer one and the Moderna one. And everybody seems to be concerned about like, why is it so fast? But, if you haven't read up on it, it is worth knowing that this vaccine has been in development for over 30 years because it's designed to be what we call like a plug and play vaccine. So they could get the genetic code and plug it into this vaccine and have it within a year. So they had been trying to develop this vaccine before the pandemic, so that they could adapt vaccines quickly to new pathogens. So it's not brand new. So that's one thing. Um, just to go through how it works, it is mRNA, or it is a code for protein. So it doesn't change your DNA. It doesn't even go into the nucleus of the cells. It has a coating on it. It gets taken up by the cells, and the cells locally, by where the injection happens, churn out the spike protein from the coronavirus. Only the spike protein. Nothing about it is infectious or contagious. You cannot get sick from it. And then your body develops natural immunity to those spike proteins. And it may actually protect from the common cold versions of coronavirus as well. So I think it's been overwhelming for people to sort fact from fiction and determine their own opinions about the vaccine. Um, every day I'm surprised by the new misinformation that comes out. And the latest yesterday was about concerns about fertility, that the spike protein morphologically looks like a protein in placentas. So could it possibly cause infertility? And so the best argument against that nugget of misinformation is that if it does, it's not going to be any worse than getting coronavirus, because coronavirus and the vaccine have the exact same spike protein. So we haven't seen any evidence of infertility associated with coronavirus or uterine or pregnancy inflammation. So this is just like something that's created, and it has been actually, um, with other vaccines brought up as well. People often come up with the same direction of misinformation. So we have to be very careful about where we get our news from. um, the vaccine is still a ways away from being available for children. I would think realistically it would be next fall at the earliest, maybe next winter, depending on the supply chain and how the studies shake out. You know, the studies are looking at 12 and up now, and they will start enrolling younger and younger children over time. But by the time our children are able to get it, we'll have a lot more information. It seems like the leading OBGYN groups have come out and said, even though pregnant and lactating women haven't been included in the studies, the chance of benefit is so exceeds the chance of harm that we think pregnant women should get it anyway. I think that's what they're going to say. I think they want to review the final data coming out this week, but I wouldn't be surprised if they recommend to get it, and of course recommend that they have the choice to get it, that it not be withheld. Okay, I just want to talk a little more specifically about children now. So headlines about children can be very difficult to parse out, because you see this chart I've included here about the rate of COVID infection increasing in children and the percent of total cases increasing in children. And at the beginning of this pandemic, everyone said children can't get it, children can't spread it. And that was incorrect. And this fall, when they've seen these charts, they've said children are super spreaders and children can spread it. And that's also borderline incorrect. And the truth, lays in the middle. And again, when we're looking at these graphs, we have to keep in mind that testing was different in April and May. And so we didn't detect all the children who had it. We know that up to 80% of children are asymptomatic and they're under tested. So it's unlikely that there's been really a change in the pathogen. It's more likely that it's a change in our testing practices and a change in our lifestyle, because also in April and May, children had less exposure probably than parents who had to go to work. So the 191 deaths that have occurred in children, some of them are due to the MIS-C. And it's a scary number. It's a tragedy whenever a child dies. But the positive way to think of it is that it is a relatively small number compared to the denominator, which we have 1.8 million positive cases identified in the United States, and it's probably more like 10 million children who have had coronavirus, given that we don't identify them all. So We have to take the disease seriously in children, both because they can rarely get sick and because they may transmit it to more vulnerable adults. Okay, so this is just, I wanted to include this because we talk about it so much, coronavirus, coronavirus, coronavirus. But sometimes you might forget that some of these more common things like muscle aches or diarrhea or nausea, these things might be present without the classic cough and fever. If you look up here, it's only about half of kids and adults who have those classic symptoms. So it's just a reminder that COVID can be sneaky, and that if you should always err on the side of testing if you're not feeling well. Regarding testing, just a quick reminder that the rapid antigen tests are great at identifying symptomatic people who have higher levels of virus in their nose, but the PCR test is most reliable. And some places do have a rapid PCR, so you have to really just know what you're getting. You can have a clinic where they have a rapid PCR machine. It's going to be more reliable, and the chance that you get an accurate test is going to be much greater after 5 days after exposure. So if you have an exposure, while we all want to run out and know whether or not we have it, that's just really not how it works. A negative test early in the illness is not going to reassure you in any meaningful way. So the best thing to do is to sit tight and wait until closer to 5 or even better 7 days before you get that test. Now, these charts are semi-included because I want to mention the new quarantine guidelines that came out from the CDC. So this is just a typical course by which day have symptoms started. So after 5 days after, say you're exposed on day 0, at day 5, half of the people who are going to be sick will have had symptoms. By day 7, 75%. And it gets up to like 95% by 11 and a half days. This is why the 2-week quarantine kind of makes sense, because most people who are going to get sick will have had symptoms by then. Additionally, you see the asymptomatic people, like how many of them will be contagious. It's a broad distribution. This one doesn't start right after exposure because it's very difficult to know when an asymptomatic person was exposed. But we know that once they test positive, half of them test positive for about 5 days. Another 20% might be up to 7 days, and the rest stop shedding really by 14 days. And because of that, the new quarantine guidelines are 7 days plus a test. The test can be an antigen test or a PCR test up to 2 days before, so as early as day 5. Or you can do 10 days with no test. And what this is here is the chance that you could still transmit after this precaution. So this light blue section is the best estimate. They think that it's most likely that 5% of people who test negative and quarantine for 7 days may still be a transmission risk after that. If you wait 10 days, that goes way down. Now, why is there a bigger bar? That's because there's a range. So if you get a bad specimen quality, if you don't shove the cotton in appropriately, if it's a child who doesn't report a mild symptom during the quarantine period, you may have a higher chance of being a transmission risk. So just keep that in mind when you're deciding how long to stay home if you have an exposure. Okay, so we're going to transition into talking more about the practical pieces of advice I have for parents during this time. And this chart I put in here because I know parents. I've had so many discussions with them, and I love that parents are such good advocates for their children. But so often parents advocate for their children when they should also remember that their needs matter too. And when it comes to coronavirus, the risk of a 40-year-old dying from coronavirus is 100 times the risk of a 4-year-old. So many parents out there are saying, like, I have to protect my kids, protect my kids, protect my kids. But really, you have to protect yourself so that you can be healthy for your family, because you're just intrinsically at a much higher risk as an adult than the children. So I do think that we have a tendency to overestimate our risk and underestimate our benefits. So, for example, when you have a household contact who has coronavirus, say that, my husband, who I have meals with and share a bed with, he comes down with coronavirus, and you obviously don't know right away, so he is infectious before we identify him as a risk. What's the likelihood that I get coronavirus? It's between 20 and 30% from the studies. Um, I think that's substantial, but it's not 100%. So it's worth keeping in mind when we think about these exposures that even a true exposure isn't condemning you. Um, so when we think about other kinds of exposures, like schools, in schools where they're doing their best to distance and mask, when a child who's sick comes to school, because they will come to school either, in that pre-symptomatic period, or because they're asymptomatic, they will come to school. And how likely is it that they transmit it to other people when the school is taking precautions like masking and trying to have distance? It seems really rare, like 1 in 100. So we have to use the statistics to help us have like a grounding for our understanding of risk. And then we also have to really think through the benefits. So, the risks and benefits are not just limited to the virus. There are risks of coronavirus. There's risks of avoiding childcare and school and daycare because of coronavirus. Say child safety, if you're not supervising your toddler as much because you're balancing work calls. We have to think about how sustainable it is for the duration of this this pandemic for us to it's not a 2-week lockdown, it's a marathon. So we have to think really about our needs more long term. Mental health and parental burnout are real factors to consider. Then we have to think about the benefits of childcare, school, and daycare to the child, right? There's social benefits, mental health benefits, developmental benefits, and there's also benefits to parents. So I would I would really encourage you to think through those things because it does matter. It does matter. And every family is different. So while it would be so easy for me to say, I think this is right, you can't know without being a part of your family. What are your risk factors? What is your family's risk tolerance? A parent is in the best position to make these decisions. So I just want to go through this process for how you might approach decisions about the holidays. So when you're thinking about maybe potentially getting together with family members, I think it's pretty easy to think about the risk. Who is coming? What are their medical conditions, their age, their risk factors? How bad would it be if they did get coronavirus? What's their exposure level at baseline compared to your exposure level at baseline? What is the risk entailed by travel? Um, and then we can't forget to think about what happens after in terms of if you return, do you have to keep the children or the parents out of school for a week and pursue extra testing because we might take exposure risks that the rest of our pod or our community doesn't deserve to be exposed to. So we can think about our comfort level, and then we have to respect the comfort level of the people that we're interacting with. You think about how we can mitigate the risks. Like if you really want to do something, there's always, rather than it just being black or white, there's a spectrum of gray. You can, get together outside and masked. You can do it with a smaller group. You can try to um, lock down before you see relatives for 5 to 7 days and get a test and decrease the risk that you'll bring coronavirus. So there's a lot of different ways to try to make it work. And then I think at the end of the day, you have to think about the goal of the activity. Like most of the time when we're getting together with family, we want to relax and enjoy ourselves. And if you're not going to be able to do that because you don't feel comfortable about it, it may not be worth it. And you have to understand that different family members will have different opinions. And at the end of the day, If you're more conservative than the rest of your family and don't feel comfortable, you deserve to feel safe, and your family should respect your decision. And if you're more liberal in your exposures than the rest of your family and they don't feel comfortable seeing you, then you have to also respect their decision. We all have our own opinions about this stuff. This just goes over some of the things I was talking about masks, distancing, being outdoors, and hand washing. Because it's worth bringing up this one anecdote. The CDC published about a family reunion that happened last summer. And unfortunately, a teenage girl, like a preteen, maybe 13, was exposed to coronavirus at school and decided to still go to see her family. And she had a test. It was on day 2 or 3, so really too soon after the exposure to be valuable. And she had a little bit of a runny nose or congestion the day of the weekend getaway. So then she went and stayed in a home with 12 family members, and she also saw 17 family members outdoors, distanced and masked, for a barbecue where they were at different tables. And like half of the people who stayed in the house got coronavirus, including some of the elderly people who ended up in the hospital. And none of the people who saw her in a distanced manner outdoors got it. And it just goes to say that, like, over and over, we see these things really do work at decreasing the risk. When coronavirus positive moms have newborns, if they wear a mask and wash their hands, only 2% of their babies are getting it, even when they're doing direct 24/7 care, and that's because masks work. A lot of parents have had concerns about their children's development during these times. Um, and and I think it's really difficult. We're all doing more with less support. So my number one piece of advice is to really choose your priorities and goals. So you may not experience growth in every area like you would in a normal year, and that's okay. But if you pick what's important for your child, maybe it's keeping up with age appropriate math skills, or tackling reading, or whatever it is. You pick a few things and you devote your energy to that rather than trying to keep up with everything. You may be more successful. I think with the younger children in particular, it's important to focus on social and emotional development. This problem solving wheel is something I have up in my kitchen. And sometimes when my kids are fighting, I say, like, go look at it and think about what you're going to do to figure out your problem. Because investing in teaching problem solving can pay off for parents in terms of making your life easier. But so many people have asked me, like, is my 2-year-old, 3-year-old going to be harmed because of the lack of exposure to friends or being exposed to someone who's masking? Will that harm their emotional development? And over, I've talked to a lot of other physicians and psychiatrists about this, and really we think no. And why we think no is because at home, when you're together with your kids, it's actually like a rich place for learning and development. You have the family meals, and you talk to each other. You are doing tasks that are really great for learning, whether it's chores or preparing meals or gardening. These things will continue to help your children develop problem solving skills, identity. They identify their emotions, they interact with others, and they matter. So don't sell yourself short. A few things to make like day-to-day life easier. I recommend planning ahead and incorporating family meetings if you haven't. Family meetings, like say once a week on Sunday, looking at the schedule for the week, setting goals for different family members, talking about what worked and what didn't, and encouraging your kids to problem solve through can be really rich opportunities for them to feel seen and heard and connect and learn some of these skills, because we all have a chance to like model how we want our children to approach challenges. So sometimes it can be really helpful for your kids to hear, like, I haven't worked out in 2 weeks, and this week I really want to set a goal to work out, and will you like remind me if I don't get time that I need to do this? And that is a way to be a role model. Other people have said, put the passwords up on the Zoom schedule and teach your children how to navigate their remote learning if you're doing that. Um, some people debate like schedules versus routines, and you just have to know what works best for your family. And sometimes you may have to say no. So in my book, I give this example of like when I was remote learning with my kindergartner, I the only way I could get him to do remote gym was to do it with him. And I just didn't have the time or the energy to do it. It took a lot of fighting about it. So we said, like we're not going to do it. We're just not going to do it. And during that time, you're going to go outside and play, and you're going to ride your bike or play basketball or something, and we're going to call it a day. So we, thoughtfully just had to say no to that one. A quick reminder about screens, because all of our children have so many more screens than they usually do. One is about eye strain, especially when it's getting colder. When you're looking at screens a lot, you'll be getting dry eye, which can be really uncomfortable. So the best advice about that is to look away from your screen at least every 20 minutes. Um, and to focus on something further away for at least 2 minutes is what they say. So obviously that doesn't work with all the Zoom schedules, but it can be really helpful if your child's starting to have dry eye. Take a look at what your kids are listening to in terms of their volume level. If they're plugged into the headphones for hours and hours, it may be worth setting. You can set a volume limit in the settings so that they're not hearing loud noises all day that might damage their ears. It's worth thinking about, if you haven't, what kind of internet safety precautions are in place. You would be so surprised by how quickly a child can navigate from a benign child-friendly YouTube site to something inappropriate. Or kids are so sneaky about bullying each other. I've heard Google Docs is actually been a big place where people are bullying these days because it's an unmonitored space for some. So kids are like chatting back and forth in the Google Doc that they have access to. If you are worried, you can outsource this. There's services like Circle and Bark that will monitor your devices. And then also to think about distraction management. I think it's one of the biggest challenges. I have a 2-year-old, so keeping her from interrupting her brother's schooling has been a big challenge for us. More about the screen time. It's worth recognizing for older children that that it has its benefits, and connection, even if it's by screens with your friends, is good for mental health. Some screen programs can be educational, and it can be helpful. But there's also the cons of screen time, which we're probably all aware of. We know that kids who are on screens a lot don't do as much physical activity. They may get lonelier. They may feel addicted. The bright light may affect their sleep. The blue light glasses are supposed to mitigate the effect of looking at the screens and disrupting your circadian rhythm. The blue light glasses don't help with screen time, or don't, kind of give you a free pass to use all the screens you want. But it's worth thinking about how your own child is doing with their screen usage. Some children tolerate it better than others. Um, I think you can use the breaks from the screen to kind of recover, whether it's getting moving and getting outdoors, or some children, even, sensory experiences like working with Play-Doh or cooking or using their hands for art can kind of be a way to ground them after being on the screens all day. Okay, so just to talk about more ways to organically promote your children's mental health. So you've probably heard of Maslow's hierarchy of needs. And I thought this was a helpful way to think about it, because one of the most important things that we do as parents is we assure that our kids have like the physiologic needs, that they're eating good food, that they're sleeping, that they feel safe. That's the next one, right? So unfortunately, I've heard a lot of families, because parents are scared, of coronavirus. Sometimes when they're out and about, like at the playground or on the street, I've heard them say, like, you're going to get sick, put your mask on. And I think we have to think about the messages that we're giving our children about their safety. Because, I mean, the truth is that if they're not wearing their mask, the primary problem with that is not that they're going to get sick. The primary problem with that is that they're breaking the rules and not being like good neighbors and members of their community. So if we can encourage those things rather than saying you're going to get sick, you're not safe, like the world's not safe, it may be helpful for them for their mental health, because we know that the chronic stress is harmful for your mental health and your physical health. So making sure our children feel safe is really an important job. And luckily, because coronavirus is better for children than adults, and I think that we can do that and be honest about it. That most kids, if they get coronavirus, will be fine. So if you haven't told your children that, I would encourage you to do so, because the virus has turned our worlds upside down. But the kids should know that they're safe. And then the belonging and connection. So, in days with more isolation than ever, the connection is really valuable for your mental health and well-being, and like the love and the self-actualization. I like to think of the self-actualization also as creating things, because I think the process of finding flow or like getting into a task is really good for your mental health. So, that can be something as mundane as like a puzzle or laundry or wrapping Christmas presents or whatever it is. And my friend, you might have seen a couple of things from her, Dr. Hina Taleb. She puts together some of this stuff. We're both on Instagram doctors. So she put this together of some of the other good things you can be doing with your kids to promote their mental health. And this is just like really a pet peeve of mine is that the physical activity. So before the pandemic, more than half children didn't meet the guidelines for physical activity, 60 minutes of good exercise every day. Most kids didn't meet that. And now, like, no kids meet that. But we know that physical activity helps with focus and processing speed. It improves your school performance. It helps with your mental health, decreases your anxiety, depression. It helps with your coping. And we know that it also boosts your immune system. It means that you're less likely to get sick if you're exercising regularly. So getting your kids moving is really like core to their functioning. Yes. So I do want to leave a little time for questions. I'm going to rush through these last slides, but coping during this time is really important. I would encourage, all of us to keep in touch with our loved ones, because you never know until you ask how the pandemic is sorting out. It's been interesting in the data that some of the 18 to 29-year-olds have been worse off during the pandemic. I thought that some of the grandparents, especially those in retirement homes, might have been really isolated and scared and worse off with their mental health. But when you look at the data, it's really the young adults and the teenagers who are having, I think, the hardest time with this. And supporting those loved ones is really important. And you can still ask for help. This is just a reminder that effective parenting isn't necessarily perfect parenting. The most important thing is that your child feels loved. You don't have to be perfect. It's okay to take breaks, and you're not going to be as productive as you would be during a normal year. When your resources are constrained, you don't have like that many options. You can get more help from outside of your pod or within your pod, or you can lower your expectations. And a lot of people, especially alumni from Barnard and Columbia, could do to lower their expectations. Like the meals might not be as as nice, or the house might not be as clean, but it will be okay. And growth mindsets have been in the news a lot, and I think this is a good opportunity for it. We're all learning new skills and conquering new challenges during this time, parents and kids alike. So it's a reminder that you're a role model for how you approach these challenges. And you can be, especially with your older kids, you can be honest with them and say, like, I'm having a tough time and I'm going to try to do this to make it better. And you can help them learn coping skills. I have it in my mind that for all the bad that's happening to our children due to the pandemic, these coping skills that they're learning now may help them later on when they, lose their first job, or somebody dumps them. These things may, the way they deal with stress, we have more access to our children than ever, so we can help them try to foster healthy habits for stress management. I just wanted to make sure everybody's aware that children, when they're anxious, sometimes have symptoms that are somatic, which is, not, they may not say, I'm feeling anxious and worried. They may say, oh, my belly hurts, I have headaches, I'm tired, I don't feel like eating. Younger kids may have accidents when they haven't had accidents in months. And so just to be aware that some of those more subtle signs can be signs of anxiety. As a parent, you don't have to treat your child's anxiety alone, but you should know like some of the first aid sort of things, which is that you want to maintain an open dialogue. So you don't want to dismiss their feelings. We want to allow emotions, and you want to normalize them. Like, yes, of course you're anxious. It's really like an unusual way to take your test is, to do it online, or it's really like, of course you're sad that your sports are canceled, whatever it is, you know, yes, it's normal that you're experiencing that, and I hope you feel better. But I think what is important for us to recognize is that particularly parents of teens, I worry about. There was a New York Times article that said mothers are the shock absorbers of society, and so when you hear these complaints about things you can't fix, it can be very difficult. And so just be aware of like the stress of that, and make sure that you're investing in your own coping skills, because it's very difficult when your family is having trouble and they need you. So you're going to need to have your support network, your friends who are dealing with the same thing, your exercise routine, your relaxation routines to help you get through it. So that is the end of my talk. I've put some resources at the end that I'll try to send out by email so you guys can have them, just about virtual learning and coronavirus and mental health issues. So I'll send that along, and maybe now we could transition to talking about some of the questions. So let me turn this off. Hi.
Kelly, thank you so much for that. And as a parent of 3 teenagers, I really appreciate your last comment. We are definitely the shock absorbers, and it's been rough for everybody, I think. So we have some really fabulous questions. Um, for starters, is it safe to go get a checkup for yourself, and how about your children?
So it would be easy. Like I would just say yes, 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 it's safe. But I have heard that different parts of the country are responding very differently to what's going on. So in New York, my doctor made it so the children who are well have visits in the morning, and all sick visits are in the afternoon, and he has his N95, and everybody in the office is masked, and it's very safe to go to the doctor with him. If you're talking about like a crowded doctor waiting room where people are inconsistently masking, that would be an exposure risk. But so hopefully the healthcare providers you're seeing are taking it seriously and have a good plan in place. I've heard a lot of people wait in their car until they're called and go straight to the room, for example. So I guess what I have to do is encourage you to ask the practice. One good thing to know is that regarding dental care, a lot of dentist office, they had better than expected ventilation because of the sealants and chemicals they use in some of the treatments. And so a lot of dentists have been able to operate safely. They have the masking that nobody got the flu from their dentist before this. Like you're unlikely, I think, to get coronavirus, assuming that they're doing what they're supposed to be doing in the office. So I would go because it has a lot of benefits.
Right. Okay, great. Thank you. Do you think school will be back to normal in the fall of 2021?
Oh, I wish it would be. I wish it would be. I don't think it will be. I so the biggest data point that we're waiting on is whether vaccinated people can still spread coronavirus. Because in the studies, the vaccines are great, like 95% effective at preventing severe coronavirus. Um, but what we're waiting on is how likely are you to have a very mild or asymptomatic case of coronavirus and still spread it. And so until we know that, um, and until we have a vaccine available for children, where we can start to approach herd immunity of like 70% of the population having it, I think masking and distancing is still going to be happening. So I've prepared, I tell my son I think he'll still have to mask next year at school. Um, and if I'm wrong, I hope I'm wrong. That would be great. But I think that we'll still have to keep some of these precautions in place to make sure that our teachers and the people who are exposed to our kids feel safe.
So, do you think that the teachers and students may have access to the vaccine, but we just don't know yet how to turn that back into normal?
Well, I don't know that the vaccine. Okay, so the current timeline that I've read about is that now it's available for first responders, basically soon. First responders, nursing home, but we don't have. They're saying like best case scenario is 20 million vaccines a month between now and June. So I would think that a person like me, who's like low risk and not a healthcare worker at the moment, is probably not going to have access till May or June. At least like I shouldn't, because we know that there are enough older people with chronic conditions who need to get it before me ethically. Um,
Mhm.
but if you just do the math on that, there's like I don't know off the top of my head, but like 350 million people in the United States, something like that. But unless the vaccine production ramps up faster than expected, I don't think 70% will be vaccinated by the fall. I don't know if children will be getting vaccines by the fall. So I think that I think that we'll still be having to use precautions then,
Mhm.
which is why I think it's important. And a lot of people have invested time in making schools as good as they can in terms of safety. They're people trying to figure out sports as best they can. There are new guidelines came out about that last week, encouraging people to be masking when playing these sports, because we don't want kids not to play sports for 2 years. Like that's a big chunk of their childhood. So we have to try to plan ahead to have the best situation we can with the precautions in place. Um,
Great. How would you explain distancing and isolating to young children? I think many of them have gotten used to this being the new normal, but how do you explain to them that this is what we will be doing for who knows how long?
um, yeah. Okay. So I guess it one thing I think goes back to like that Maslow's hierarchy of needs I was talking about. I think the constant vigilance is very hard on us as parents and on our children.
Mhm.
Um, so as much as possible, I try to like a young child, say preschool, is not going to really be able to have the impulse control to stay 6 feet away from their playmates. Like distancing doesn't even make sense in that age group, I don't think. But luckily, masks work, and so I think we as parents can protect them from having to think a lot about it by giving them limits that are more understandable. Like you have to keep your mask on to go to the playground or to see your friend, you have to keep your mask on, and we have to be outdoors even though it's raining today, whatever it is. So I think you can set your family up for success by trying to choose opportunities where you'll have to be less on guard and be less of a policeman. Um, because I think that stress makes a lot of the activities less fun. For older kids, I think it's a different ball game, right? So like, how do you keep a teenager motivated to continue the isolation protocols? And so with the older kids, and with your family members who may not agree with your level of precautions, what I would say is that there's like motivational interviewing techniques you can use, because you can't just tell a 15-year-old what to do and expect that they'll do it consistently when you're not there. You have to say, like, what do you think about this? And what do you think your responsibility is to your friends? Or have you thought about how your actions might affect your teachers? Or, and then like you have to listen to what they've thought about, because it might surprise you actually, um, to hear like why people don't agree with the level of caution. Sometimes kids in particular, they, get their news from different sources. They may pick up information that's not accurate. So motivational interviewing, the whole idea is that you ask, and you ask these open-ended questions. And if you hit a wall, then you can provide them with like something to read or consider and then go back to it later. But it is going to be something that you have to supervise and be involved in. And for teens, that feels like an invasion of privacy. It's really kind of difficult. Um, but it's necessary.
Yes, I hear that. Um, what about new parents who are certainly feeling very isolated and maybe don't have a network of, moms that they're used to conversing with about all of the various concerns that they have? Is there anything that you would recommend these new parents to be doing right now?
Yes. Okay. So in my book, I have a whole chapter about how both my kids had to go to the NICU briefly. And my son was born right before Thanksgiving. And as a pediatrician, I always tell people to protect their newborns, because newborns don't have as good an immune system, and they haven't had time to develop protection against all these viruses that we see. They can get very sick. Um, I think that the recommendations I made about cold and flu for newborns are basically the same as coronavirus for newborns. Sick people need to stay away. You want to avoid passing the baby around the table. Um, I think that sometimes, the restrictions that we're putting pregnant moms through or new parents through can be excessive. And being a new parent is a very vulnerable time. So we have to really consider what the benefits are. So if your grandparents would provide significant respite for you, and you could recover from birth, that maybe they can't quarantine for 14 days before, but maybe the benefits to you and your child outweigh the risk of exposure. It could be the case. You really have to think through, the risks and the benefits for your family, and go back to like the shades of gray. So it's not ideal if you're having people around your baby who may be asymptomatic or pre-symptomatic carriers of coronavirus. But is it possible that they could come in mask, or that they could come and, you could go for a walk together? Um, because connection, I think, is very, very important. And it's not healthy to be so isolated. I've talked to some moms who have been, you know the whole pandemic at home with their newborn, and it's just like it really grinds on you, and it can feel also unfair to have like baby's first Christmas or baby's first Thanksgiving. You don't get to celebrate it the way you wanted. So I would encourage parents, to really think through like ways to get the most benefit with the least risk.
Sure. Thank you. I know you answered this in your book, and maybe your thoughts on this have shifted given the new research, or I don't know. Would you recommend waiting to get pregnant if a healthy woman may not get the vaccine until at least the summer, as you're saying?
I would not. Well, whenever you talk about this, you have to understand that delaying trying for pregnancy could mean not having the family you want, which is a substantial risk. That has really long-term implications for you and your family. Um, and the truth is that for most women of reproductive age, coronavirus is not is not such a dramatic threat. We don't have the best data, but pregnancy does not seem to be a really significant risk factor for more severe coronavirus. Um, Pregnant women don't seem to have a lot of problems. We know whenever you get sick as a pregnant woman, you can be at risk for like preterm birth and things like that. That goes for like the flu too. But when you compare coronavirus to the flu in pregnancy, it doesn't seem much worse. So for me, I can't justify saying to delay pregnancy for that. And I think that, like I mentioned, that the OBGYNs and the high risk pregnancy specialists, I think their recommendations are going to be to get the vaccine anyway. That pregnancy wouldn't be a contraindication to the vaccine.
Awesome. Okay, we just have one last question for you, Dr. Fradin. Thank
Okay.
you so much. This has been amazing. What are your clinical thoughts on the initial side effects of the Pfizer vaccine, for example, within the first few days of the first dose?
Yeah, so it's interesting because I think it was like in late November, the New England Journal study came out about, and they had a study both about all the participants and about the high risk or the higher risk, like the 55 and up group. And that study showed that the side effects from the first dose were not very significant, but the second dose, everybody had a side effect. And everybody had fever, actually. And that was a really small group, like it was only 15 people. But I was a little bit like, oh my gosh, nobody's going to want to take this vaccine if everybody gets fever from it and everybody has to miss work the next day. But then the new data dropped today. And it's a lot of data. I kind of skimmed through it, but I looked closely at the side effects. And now we have the data with like 2,200 people and only like 3% with the first shot having fever and 15 or less percent with the second shot having fever, and very few people having symptoms such that would preclude them from having like a normal day of activities. The mild side effects are common, like a sore arm, like achiness. The low grade fevers, even, I mean, 15% is pretty common. And fatigue. It was funny because 40% said they were fatigued in the vaccine arm, and like 35% said they were fatigued in the placebo arm. So I think it goes to say like we're all fatigued anyway. I don't know, but the side effects were much more reassuring in the bigger group. So I'm not as worried about that as I was before.
Great. Thank you. Thank you so, so much.
Yeah.
Again, thank you, Dr. Freedom, for sharing your expertise and your valuable advice, which is going to help all of us as we look ahead to this holiday season and the coming months, and it sounds like the coming year. Thank you also to all of our guests for joining us tonight. Please be safe and hope to see you all live soon.
Thanks so much. Great meeting.
Again, thank you.